have this elevator pitch about what I do, because what I do is so unusual. And so the line I came up with is that I'm a nurse who uses comics to help me contemplate the complexities of illness and caregiving. And by contemplate there, I mean both through reading them, drawing them, comics, and also teaching with comics. And I started making comics while I was working as a nurse during the AIDS crisis. I was not the kid at school who could draw. I was told to stop drawing when I was a kid. But somehow being in those moments of dealing with people who were so sick and dying, and their families and everything everyone was going through, I felt this need to make sense of it. And through trial and error, making comics turned out to be the most efficient way to do that.
Could you talk a little bit about the AIDS crisis? Because for a lot of people, that's a long time ago and know very little about it.
Yeah, so the AIDS virus, HIV, the human immunodeficiency virus, was a virus that had a transmission method of what we call, it was bloodborne. And it was also, basically, before there were drugs to treat them, antivirals, it was basically a deadly virus. It's a virus that once it got into your body through blood-to-blood contact, which is either sexual or sharing needles or things that cause that kind of route of transmission. Once it got into your body, the virus itself attacked the T cells in your immune system. Basically, so the way the disease worked was it just destroyed your immune system. So then you were very vulnerable to everything else that was already in your body and external to your body. So you didn't really die so much of the virus or AIDS, you died of different, what they called opportunistic infections. So that was a disease that became a pandemic, just like the one we're living through now, but because the route of transmission was less, it was less easily transmitted, it moved more slowly. And it moved in very particular communities. And so we had this huge rush of people, seeking care. There were ways in which it was similar to the current moment, but it was different because it was, like I said, targeted to certain communities. So like in the hospital, it was really only one area that was really full of people who were dying of this disease. And I was a young nurse just out of nursing school and kind of chose this area to go into. And yeah, and it was very overwhelming, like the moment we're in now, because caregivers were so stretched and pushed, and the patients were suffering so much, and there was so much isolation, and there were just so many things to deal with all happening at once. And so that was kind of before the current situation we're in, the last time the world saw a pandemic.
You know, one of the interesting, unfortunate analogs, things happening in a similar way, and I know you and I have talked about it in the past, is that the then president of the United States, Ronald Reagan, belittled, actually ignored that pandemic. Can you say a little bit about that and how that has parallels to the situation today?
Yeah, so actually, you were right. Belittled. There's actually an unbelievable to listen to audio of a press conference where he actually laughed at it. He and the people in the media laughed.
Have any reaction to the announced from the Center for Disease Control in Atlanta that AIDS is now an epidemic, over 600 cases. And over a third of them have died. It's known as gay plague. No, it is. I mean, it's a pretty serious thing. That 1 in every 3 people that get this have died, and I wondered if the president is aware of it.
I don't have it. Are you? Do you?
You don't have it. Well, I'm relieved to hear that, Larry.
Do you?
I'm delighted. No,
You
I don't.
didn't answer my question.
Well, I just wondered,
how do you know?
does the president, in other words, the White House looks on this as a great joke.
No, I don't know anything about it, Lester.
Does the president, does anybody at the White House know about this epidemic, Larry?
I don't think so. I don't think there's been
Nobody
any.
knows.
There's been no personal experience here, Lester.
No, I mean, I thought you were keeping...
I checked thoroughly with Dr. Rugi this morning, and he's had no no patients suffered from AIDS or whatever it is.
The president doesn't have gay plague. Is that what you're saying, or what?
No, didn't say that.
Didn't say that.
I thought I heard you on the State Department over there. Why don't you stay over there?
Because I love you, Larry.
Oh, I see. Well, let's don't put it in those terms, Lester.
Oh, I retract that.
I hope so.
Leading environmentalists described the president's speech on Saturday as a fairy tale. Is there any reaction to that?
Not true. Fairy tales are not true, and this one's true. Lester's ears perked up when you said fairies. He has an abiding interest in that.
This is the movement in Denver at the Congress of Mayors Convention to press for federal assistance getting at the AIDS problem. Is there any the White House?
The president has been involved in briefed on the AIDS situation a number of months ago in a cabinet meeting, and ordered that high priority be given to research matters on it. The Center for Disease Control has been involved for some time. The president will continue to be updated. We have recently asked that $12 million be reprogrammed for research on AIDS. That's the extent of the president's involvement, which has been...
Larry, does the president think that it might help if he suggested that the gays cut down on their cruising?
Told you, didn't I? Told you.
I didn't hear your answer, Larry.
I just was acknowledging your interest in this
You
subject.
don't think that it would help if the gays cut down on their cruising? It would help.
We're researching it. If we come up with any research that sheds some light on whether gays should cruise or not cruise, we'll make it available to you. Lester's beginning to circle now. He's moving in front. Go ahead.
Since the Center for Disease Control in Atlanta reports
An AIDS question.
that an estimated...
You were
look,
close.
could I ask a question, Mark?
You were
That
close.
an estimated 300,000 people have been exposed to AIDS, which can be transmitted through saliva. Will the president, as commander-in-chief, take steps to protect armed forces, food, and medical services from AIDS patients or those who run the risk of spreading AIDS, in the same manner that they forbid typhoid fever people from being involved in the health or food services?
I don't know.
Well, could you, is the president concerned about this subject, Larry? That
I haven't
seems
heard
to
him
have
express
evoked so much
concern.
jocular reaction here. I
haven't heard
It
him
isn't only the
express.
jocks, Lester.
Has he sworn off water faucets?
No, but I mean, is he going to do anything, Larry?
Lester, I have not heard him express anything.
You
I'm
mean
sorry.
he has expressed no opinion about this epidemic?
No, but I must confess I haven't asked him about it.
Would you ask him, Larry?
Go back into this problem.
Have you been checked?
President going to
What? I
ban
beg pardon?
mouth-to-mouth
I didn't hear
kissing?
the answer, Larry.
It's hard work. I don't get paid enough. Is there anything else we need to do here?
many people that get this have died, and I wonder if the president is aware of it.
I don't have it. Do you?
You don't have it. Well, I'm relieved to hear that.
Do you? You didn't answer my question. How do you know?
The president, in other words, the White House looks at this as a great joke.
No, I don't know anything about it. What
Does the
were we-
president, does anybody in the White House know about this epidemic?
And of course, viruses don't discriminate. But yeah, it was ignored because it was a marginalized population that was infected, and he refused to say the word AIDS or HIV for a very long time. And it didn't get the resources that it needed to keep it from spreading, much like the situation we're in now.
Well, let's go on a bit with story of how you went from being an RN, young RN, during this crisis to becoming a well-known graphic novel artist, graphic medicine artist.
Yeah, so I started making comics and I felt like they really worked, and I wanted to think about why, and I also wanted to think about theory. And that background in the humanities kind of came forward, and I thought, what kind of theories are out there about why comics could work, why stories work to help us heal, and could comics, more absurdly at the time it's felt, could comics have a serious place in the discourse around health and illness and caregiving? And so I studied in this field that was called medical humanities and bioethics. And medical humanities are basically each of the disciplines of the humanities applied to how we think about and look at healthcare. Bioethics is, in a lot of ways, philosophy applied to medicine, and each of the different kind of approaches, like literature in medicine, medical anthropology, history of medicine. So that's what kind of the medical humanities are. And each of them brings their disciplinary lens to how we provide healthcare and how we think about healthcare. And each of those really, ultimately, each of the ones I mentioned is rooted in story, right? Anthropologists look at, through artifacts, the story of how people lived. We think about bioethics. What is the right thing to do in a given situation? We think about that in the case study, which is basically a story of what has happened. I could give you an example. History, obviously, is stories of what has happened. And so I wanted to think about the role of story and apply that to comics.
Great.
And then while I was finishing up that degree, a doctor who at the time was in Wales, named Ian Williams, had coined this term graphic medicine and was doing some very similar work to what I was doing. He was thinking in a lot of similar ways. And we both had come across the same book at the right time in our education in the health humanities, the medical humanities. And it was this book called Mom's Cancer that so smartly kind of was a case study in what exactly we were hoping could happen, that comics could be taken seriously. Comics for adults, nonfiction, by people who are living through things.
Mm-hmm.
And we looked around, both of us individually in each of our corner of the world, and saw that there actually were a lot of books out there that did that same kind of work. So Mom's Cancer was only one example of books that just really weren't being thought about as a whole. And he used that term graphic medicine. And when he coined that term, he actually kind of meant it as a bit of a joke. Like, could the graphic be the medicine? Could comics actually help people get better, right? And he set up a website called graphicmedicine.org. And that was through that he and I met, and through he and a few other of my current colleagues, we all got together and started talking about this seriously. And so to answer kind of that question of like, why comics? Like, what could comics do that other aspects of the arts or humanities, what do comics do uniquely? And first and foremost, there's a great history of comics being used as a teaching tool, because comics are great at teaching. They use story, they use color, they're much more easily engaged with when the reader, the person who needs to study and learn, is under stress than a big block of text. So this is an example that was made quite a while ago. by the King County Public Health Department. And the King County Public Health Department includes the city of Seattle. And they had made a comic a long time ago called No Ordinary Flu about the 1918 pandemic, which you may have heard about recently because it's the most recent time something like this has happened, something like what we're going through right now. And they made this comic a number of years ago to show what quarantine would look like. What would it look like if you had to just stay in your house all the time? And this ended up being so prescient because, of course, that's what we're dealing with right now. And also, Seattle was one of the epicenters for the coronavirus. And so this has been really an interesting example to think about now that is in some ways in comics, we have evidence that we had thought about the fact that we weren't quite ready for this. And this was a teaching comic to help us figure out what this current moment right now would look like based on the historical example.
Got it.
And then there's another example there of a comic that has been kind of created in the moment by a cartoonist named Ellen Forney to just really show the proper way to wash your hands. And this appeared on the Washington Post. And
Just in the past 2 weeks.
Yeah, that very recently. In fact, all the examples I'm going to use to show what comics can do, I'm drawing from a page we have on the Graphic Medicine website right now, where we've felt like in some ways the best thing we can do is just start gathering all of these comics together and start kind of categorizing them and looking at the categories of the comics that are being made. Every one of these I realized yesterday as I was thinking about this, I can use just COVID-19 comics to prove all the incredible work that graphic medicine can do. So this is teaching.
Yeah, it strikes me all the time, actually, how in times of adversity, let alone times of uniquely frightening events, that it drives us to bring our best, most creative selves forward.
That's interesting. And you know, it ties back to kind of how I said I ended up starting making comics because yeah, it was in a crisis. Like in a crisis where the regular things aren't working, we turn to creativity. We turn to trying to find another way. And that's exactly how I started making comics. I think that's exactly why graphic medicine in a moment like now is really useful and powerful.
You know, I was fascinated this morning listening to NPR, and they had a story focused on engineering work going on in the state of Michigan right now, where in order to produce more ventilators, they have many, many tiny parts that have to be engineered to the micron, you know, incredibly precise. And to start up a new line of these machines, they had to make a new mold, which apparently is going to weigh 2 tons, and I think it's made of aluminum. And these engineers here in the state of Michigan are accomplishing the design aspects, coming up with all the specs to be able to make this mold in a weekend, work that would usually take weeks.
Wow. Wow. Isn't that amazing? And
So whether you're an artist or an engineer, that creative drive is there.
Right. And it shows too how, I mean, there's a couple of things I've been thinking a lot about. One is even just the way that we're learning and teaching now, it shows the possible, right? And the arts are so amazing at that. And yeah, it shows us what's possible and that there's different ways of doing things than how we always do them. And that makes me also reflect on the ways that, and this ties back to the AIDS crisis, and I'm thinking a lot now about how this is the things that are going to emerge from this moment, is that epidemics throughout history and crisis moments, they change the world.
Right.
And AIDS changed healthcare profoundly. AIDS changed activism profoundly. AIDS changed so much. And I keep thinking about the ways in which this current moment is going to change the world moving forward.
You know, it's interesting. It had to have been not much more than 2 weeks ago, but feels like 2 years ago, that we had as a guest a man named Josh Gottlieb, who's a physics teacher here in Kalamazoo. And we had a brief discussion in which we were sharing our feeling, and Josh was exceptionally articulate about it, that this pandemic presents a silver lining, actually many silver linings. You know, as horrific as it is, Josh is really deeply committed to working with his students at Kalamazoo Central High School here in, as he puts it, being at war with climate change, you know, working in many dimensions to defeat climate change, to stop it. And he points out very accurately and very importantly that as mind-boggling, as horrific as the toll of deaths has been to date and will be in the coming weeks, it's hard to say it, but nothing compared to what we'll face if climate change is unchecked.
The goal of this class, as we first strategized it, was to fully address the climate crisis, climate change. How do you feel about addressing that today, given the context for the coronavirus crisis?
Well, in an emergency, you need to triage. You need to deal with what is most essential first. So we clearly need to address the coronavirus pandemic, and I think we're beginning to do that. There's a silver lining in the coronavirus in that we may learn some lessons about acting in an organized way globally to address emergency situations. And some of that learning may help us in the future to get back on track addressing climate change.
Yeah, unless anyone think you're being glib, because it almost could sound as though you're belittling the coronavirus. You know, we'll get back on track after this. And we know, we've been talking all day, that that's not the case.
No, coronavirus is a once in a century pandemic. Coronavirus is as serious an emergency as I remember in my lifetime, and I'm 45. That being said, it pales in comparison to what is coming, the scale of the emergency due to climate change.
Yeah, because I think currently the scientists are, you know, and the data scientists are suggesting worst case scenario in the United States have 1.7 million deaths, you know, out of 360 million people. British scientists are saying worst case scenario. No, I think they're saying moderate scenario, 500,000 in the UK, which sounds and is horrific. And we're not even mentioning yet how we feel personally about it, about the people that we love and are concerned for. But that is fractional, you know, 1.7 million in this country compared to what we're facing with this climate crisis.
We could lose hundreds of millions of lives due to climate change by 2100. We could lose billions of lives. There's a study that came out that said we may lose up to 90% of the population on this planet, human population on this planet.
That's right.
Oh, let's go back to your slides here.
So here's another example of how powerful teaching to all comics can be. This is my colleague, Monica Lalanda, who's an emergency physician in Spain, which we know has been hit so hard. And she is also a cartoonist, obviously. And so this is basically symptoms of coronavirus in a quick visual. And even if you don't speak Spanish, you can understand this, right? And that's one of the great things comic can do potentially, is because the power of the graphic, they can transcend language barriers and literacy challenges. So another thing comics can do, especially in this moment, is help us deal with things that are scary. Right? They can use humor, they can use absurdity to really not only help us deal with it by maybe using humor, but also just cope, right? you know, this, you see something like this and you're like, oh yeah, I know what this feels like, right? And it can sort of like take the reality and use a metaphor to turn it into this absurdist thing that helps us cope. This is Raj Chast, a New Yorker cartoonist who specializes in kind of single panel comics. And the one that she has coming up in this coming week's, or this current week's New Yorker, is the following. This one, which again, the absurdity, but yet it does sort of personify a certain feeling, right? You look at that and you think the absurdity personifies a feeling. And my favorite part of this is the bird in protective gear that just cracks me up.
And certainly, you know, everywhere you look, there are memes that are tackling this need for us to find humor in the darkness.
Right, right. And comics can also kind of communicate from the front lines. They can help us kind of deal with difficult experiences. And these 3 examples from colleagues of mine. Shirley, who makes comics under Shirley Whirl on Instagram, is a medical resident in Chicago on the front lines. Marina at the top is a nurse in Spain on the front lines, who's also a cartoonist. And on the bottom right, there is a medical illustrator who goes under the name Merlin professionally, who is currently in bed with the coronavirus, who's done this amazing series that we link to on the Instagram, on our graphic medicine account and on Merlin's Instagram, of just, you can watch the progression of the disease unfold. She said that for her, it came as a wolf, this pressured wolf on her chest that
Really? Wow.
unrelenting. And again, comics can use metaphor. You know, you see the metaphor of the frontline worker fighting. You know, comics can make those metaphors we think about illness and health in our bodies literal. And so you can express that and have this experience of expression through that.
You know, I got a text from a friend this morning, and she said she had a dream that serial killers were attacking her. And I think many people are having these vivid dreams and nightmares currently.
Yeah, I've heard a few stories like that too. Yeah. Because in our dreams, like in our comics, we try to make sense of the world.
Absolutely.
So this is an example of a comic by a bioethicist named Craig, who does kind of extensive blog posts, but he's really taken to kind of, like I said, trying to visualize those metaphors. And so comics can help us think through difficult issues. And he often says that in creating the metaphors or creating the drawings, he actually comes to understand his position as a bioethicist a little bit more deeply, or even work through some of his ways of thinking through it by drawings. And this started out of need. He said that, you know, he would do these blog posts that were text only that he didn't feel like people were engaging with. But once he started doing these little drawings, he felt his engagement on his posts went much higher. And of course, engaging with some of the bioethical issues coming up right now is so important. And so this is an example of that, how comics can help us think through difficult issues.
So this is Craig Klugman at Northwestern, right? Sorry, at Paul.
That's right, yeah. And then finally, one of the categories I want to think about is the ways that comics can help us look at past, present, and future. And one of the categories we found that people were turning to in comics right now was historical. You know, how has our human race dealt with epidemics and pandemics in the past? And this is just an example of a kind of an illustration, infographic comic that looks at kind of where we are with numbers and history of deaths by epidemic. So just getting a feel for kind of where the current moment falls and where it will fall eventually in this history that we have of epidemics as human beings.
It's absolutely stunning to see that list and see the numbers.
Right. And also there's this sense too that like, this is something that has always happened.
Right.
And there's some, and I find comfort in that. I've been finding comfort in that for a while now, to know that, you know, we've been in bad situations before and it's horrible. And yet we as human species, we continue. We go on. We pick up the pieces and we move on.
Yeah, well said.
And this is a panel from my book called Taking Turns. And it's the panel that is explains the title of the book. These are two doctors that worked during the AIDS crisis, David Blatt and David Moore. And in my book, I'm kind of meeting them and they're talking to me about what that moment in the 90s was like. And David Blatt said to me, and this was from a real interview, this real person said this to me. He said, on Unit 371, which was our AIDS care unit that he was the director of, he said, it seems to me that the spirit is this could be me, not just for the gay guys. People somehow get the empathy thing, that we are all just people taking turns being sick. I may be the nurse or doctor today, but I could be the patient tomorrow.
Yeah.
And it was eerie how much that reads into this current moment also when I thought about it, because of course, during the AIDS crisis, that was the case. Many of our caregivers were also our patients, but that's unfortunately because the current virus is so easily transmitted, that's very much the case right now. Our frontline care providers are ending up in those beds and caring for their own colleagues again.
You know, I guess, MK, it makes me think too of because there's been many moving reports, you know, from, as you say, the front lines, you know, a nurse surreptitiously making a video at one of the major hospitals in New York City and saying, I don't care what they do to me, you know, if they prosecute her for communicating with the outside world, and the New York Times carried this, but it's along the lines of what he said there, that he might be the patient tomorrow.
All the patients in this room, all the feet that you see, they all have COVID. The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming. Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them. Five ventilators. Oh my God. You know, we now have these 5 vents. We probably, unless people die, I suspect we'll be back to needing to beg for ventilators again in another day or 2. There's a mythical 100 vents out there, which we haven't seen. Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need and even just the materials that I need physically to take care of my patients. And it's America. And we're supposed to be a first world country. On a regular day, my emergency department's volume is pretty high. It's about 200 people a day. Now we're seeing 400 or more people a day. At first, we were trying to isolate patients with cough and fever and be more careful around them, but we weren't necessarily being extra careful around all the other patients. And then we started to realize that patients who were coming in with no fever but abdominal pain actually had findings on their x-rays and chest CTs that were consistent with this coronavirus, COVID-19. So if someone in a car accident gets brought in, we get a CT scan of them, and their lungs look like they have coronavirus. We were seeing a lot of patients who probably had COVID, but we didn't realize. 10 residents and also many of our nurses and a few of the attending physicians got sick. The anxiety of this situation is really overwhelming. You know, all of the doctors, it's hard for us to get tested even if we want to, even if we have symptoms. We're exposed over and over again. We don't have the protective equipment that we should have. I put on one N95 mask in the morning. I need to have that N95 mask on for every patient I see. I don't take it off all day. The N95 mask I wore today is also the N95 mask I wore on Friday.
Exactly. I mean, yeah, it's bearing clear that it's always been unfair, right? There's always been privilege and injustice. And it's just becoming, you know, it's like the veil has been ripped away. I think that process had started where we started talking about privilege and we started talking about, wait, it's not fair that some people have health insurance and some people don't, when it's nothing to do with anything they'd ever done, but just a product of perhaps where they lived or the opportunities they've had. And yeah, it's just really becoming even more clear now. So just a couple of other little things I wanted to say about graphic medicine and sort of some of the philosophical underpinnings of it from those of us who practice it. And I think I'd like to think it informs the way it's kind of evolved in the world. First and foremost for me is that the way that healthcare has been set up, it's traditionally been very paternalistic in that the doctor is the sort of father figure and the nurse is the mother figure and the patient is the child, right? The father gives orders, the mother carries out those orders, and the patient, the child, is just supposed to do what they're told without question. But I think the AIDS crisis with that and the disability rights movement were two things that and the cancer, kind of the cancer activism, threw that open, again, in a moment when there weren't any good answers and people felt like they were not being treated as equal humans. And the current moment has changed, and graphic medicine really believes that those best positioned to represent illness and caregiving are those living with it. And that's historically not how it's been. Doctors decide what the drawings look like. Doctors decide, who've never experienced the diseases they're talking about, most likely, decide what that looks like and what it means to have it. But graphic medicine wants to just really challenge that and turn that on its head so that the people who are living with something like, say, Parkinson's, you know, a guy named Peter, who is a cartoonist with Parkinson's, he drew a book that shows us what that means. And then those of us who teach graphic medicine, we then show our students, listen to what the person who has this disease is telling us about what it means to have it. And what the person in that drawing there is holding is a motto of the disability rights movement, which is nothing in Latin there. It's nothing about us without us, which is, again, as I said, I think an ethic of the graphic medicine movement to amplify the voice and put on equal footing the voice of the patient and the family in their care. The next image here is a panel from the Graphic Medicine Manifesto, which is a book that some colleagues and I created. And this is something that's really important to me about the movement. And so what it says is, so too graphic medicine resists the notion of the universal patient and vividly represents multiple subjects with valid and at times conflicting points of view and experiences. So for example, if in your entire class, there are two people who have asthma, those people may not agree on what asthma means in their life based on their life and their particular disease. And what graphic medicine wants to say is both of those representations of what it means to have asthma are absolutely valid. And again, in medicine, traditionally it was, this is the asthma patient. And we're saying, no, there's no such thing as the asthma patient. There are people with asthma, and they're going to manifest it differently. And those are all valid manifestations because we are all valid human beings and our experiences need to be validated. And this is a panel from, this is a cover of Brian Feast's Mom's Cancer. And as I mentioned, this is a formative book in our field because he proved early on that this is really doable. And what he said about making this book, he says, comics were the right medium for the story I wanted to tell. They meld words and pictures to convey a narrative with more economy and grace than either could alone. And I think that's right. What the advantage of graphic medicine is that we have both image and text, and each of those does important work. And each of those, interestingly, works in different parts of our brain. And when we do both at the same time, we're, we always like to say we're literally using more of our brain than we would be if we were only engaging in one or the other.
Wonderful. Oh, thanks, MK. I'd like to take a pause and then come back for one more segment.
Cool.
So, MK, you've been a guest in my class previously, and I know that you talk to all kinds of audiences all around the world these days. And generally, the students in my classes are 85, 90% from the state of Michigan, preponderantly from smaller cities and small towns, although we do have a sizable cohort from Detroit and from Chicago. We have very good numbers of students, international students, who come from Malaysia or Saudi Arabia, many other countries. We know that by the time, God willing, hopefully, classes resume in a somewhat familiar way at the end of August, that the world will have changed radically. And it's unknowable how much suffering all of us, and I'm thinking of my students and my students to come, will have endured. Today is April 2nd, 2020. What would you like to say to our students who are 18, 19 years old now?
I think that this will be a formative experience in your life, and it will inform I think it will inform the way that you move forward in the world, because the world will be different as we emerge from this. When I think about going through it and getting through it, I think the important thing to keep in mind is, things like this have happened before, as I've said, and we get through it. Take notes, because you're going to want to look back on this time in the future and our memories fade. Take notes, sketch down things, keep a kind of a journal of what you're going through. It doesn't need to be all text. It can be drawings. Make it a way that helps you get through this moment, but also is a historic document for the future, for your future, for the world's future. And know that we will get through this, and we will emerge hopefully changed for the better, and perhaps more aware of things we should have been aware of all along: inequality, hand washing, simple things that we should have thought more about in the past, little and big, structural.
Have you had time to think about the changes you personally are going through? And do you have a vision of things you want to accomplish in the coming weeks and months?
Yeah, for me, I want to use this time to do a few things that I kind of always wanted to do, but hadn't quite gotten it together. So one of them was I wanted to make a comic about what's called advanced directives, which is how we let people know what kind of medical care we want or don't want. I wanted to make a comic about that because it gets really confusing and it's hard to make those decisions and have those conversations. And so I've been working on that, and that's almost done. I've always wanted to make a giant watercolor comic, and I'm working on that. It's not something I'm good at, but it doesn't mean I shouldn't try.
Like
And
giant, what's giant mean?
it's about yay big.
Right.
And each panel is much larger than it would be normally. And I really admire watercolor comics. I think they're really beautiful. And I'm trying to figure out how to do that. The thing about being an artist, I think in a lot of ways, particularly, I shouldn't say an artist broadly, but about being a cartoonist, is that there are places where you can go to study it. But even when you do that, and I think maybe this, you could tell me if you think this transcends to the arts generally, is that you can learn all the technical skills, but there's no, in a lot of ways, like once you get those technical skills down, you really have to figure out what that means for you and what your style of making that art is. And that really isn't something anyone can teach you. And it's like a lifelong evolution of like, what is my style? How do I get how I picture it in my head to be what I can actually am capable of doing? And how do I accommodate for my limitations and play on my strengths and all that stuff? And so for me, that's what this watercolor comic thing is about, is like really pushing myself, 20 years into making comics to do something differently and something I wanted to do. And then the last thing is that I've always wanted to play a musical instrument. And I thought maybe the easiest one to start with would be short of the recorder, which I think I kind of remember from grade school, the ukulele. So I actually am trying to teach myself through YouTube videos how to play the ukulele.
Sounds like you'll be pretty busy.
Yeah, I'm trying to keep busy. That's important. The biggest challenge in each of those examples, hopefully does this, is that I'm trying to figure out ways to do things that don't involve screens, right? So I'm also working on a jigsaw puzzle, because I just feel like we already were spending so much time in front of screens, but now I feel like I am even more.
Right.
And you go to unwind, and it's like, oh, let's watch. Oh no, that's a screen too. So what are like unwinding things that aren't screens? That's been important.
So you're going to do another triathlon or marathon or something?
Yeah, so that's the thing. I was planning to train for the triathlon in August, but who knows if it'll actually happen. But I've decided that because that's another great way to get away from screens. It's really important every day to get some exercise, and I've been working on that. And so I'm going to pretend it still is happening and train for it. And even if it doesn't, just do it that day. Just do my bike run, swim. Yeah.
Sounds good. Yeah, I'm hoping to hike in the Adirondacks at the end of July.
Oh, wow. That would be great. That would be great.
Hey, I'm so glad that we're friends and colleagues, and that you could meet up with me and, by extension, many other people.
Oh, thank you. Thank you. It's a great pleasure. As I always say, I love the work you do. I love your class. I love I don't think I know anyone who puts more work into really thoughtfully teaching than you.
Thank you. Thank you. Thank you. Hey, that was great.
All right, good. I hope you have what you need there. If not, let me know.
Anything about your morning prior to this moment particularly grab your attention?
Normally I would get up and go exercise, but I got up and just got right in the shower and got ready to be here today. I'm excited to be talking with you. It's always a pleasure.
I guess the one thing that's on my mind is about an hour ago, I came downtown to the studio here, and it's right on, literally on the borderline next to the railroad tracks that partition off the north side of the city. Kalamazoo is a wonderful, very progressive city. It's also sharply segregated racially and economically. And as it happens, for all kinds of reasons, I don't know, I think in the 1980s, an extraordinary cast bronze sculpture, Lisa Reinertson was the artist, was commissioned and then erected in a park that's on the same block as this building. In the spring, I usually, I always take students on a tour of architecture and it ends with a visit to this park. And it's always often presents pretty compelling scenarios because many of my students are from places where Kalamazoo seems like an enormous city, and it seems daunting or even frightening to venture a few paces literally over the tracks. Generally, we get there by walking through the very beautiful Amtrak train station, and arrive at this park. And because near it are a couple of missions and soup kitchens, places to assist people with drug addictions, all kinds of people that some students have never seen nearby are there. This morning, I mean, it's a splendid early spring morning, and driving down here, getting out of the car, on the one hand, it feels glorious. On the other, the city seems as though a neutron bomb was dropped on it, which destroys only people, not buildings. Anyway, so we don't have a singular person with the clarity of vision that Dr. King had. We don't have someone who is speaking from a lifetime, as short as his lifetime was, of compassion and being on a mission. So it comes to us, each of us, I feel, to embody the best of that and be an example to ourselves, conceivably to others if we're in a position to be in ministry, be in education, be in business, whatever.
Yeah, that's a really interesting thing to think about. Is almost like if all of that kind of leadership is not and vision is not concentrated, then it needs to be diffused, right? Yeah.
So before we get right into the material that I know you've prepared, let me ask you my favorite go-to question, which is, MK, what were you like as a very young person at 8 or 9 or 10?
Probably not super far away from who I am at home now. Very playful and creative and serious yet goofy. I think by the good combination of all of those things would pretty much sum me up today and then, And always looking for a creative outlet for trying to process the world, I think.
So what brought you to become an RN, to become a nurse? Because more often when I talk to students who are going to nursing, and I've been surrounded by many recently at the university, I don't hear them talking too much about creativity, and I hear them talking about being daunted by needing to learn all this science. How was that for you?
Well, part of it was that I also felt that way. I never felt like I was good at math. I was certainly more linguistically oriented. And so I thought, well, that makes sense. Then I should follow that path and go into the humanities, which is what I did and where my focus was in my studies. But then when I graduated from my degree, I just felt like something was missing and I wasn't engaged in the kind of work that I wanted to be doing on a daily basis. And so that was when, and also I wasn't finding the kind of job that I would find satisfaction in. And so then that's when I turned back to this idea that, I mean, my mother was a nurse and I kind of, when I was very little, had always thought I would be a nurse, but then turned away from that. Probably discouraged by not doing well in the sciences and math. And so then I turned back to it as an adult who thought, well, the difference between a problem unsolved and a problem solved is just time, right? I can't remember who said that, but I think that is really true. And so I thought, well, now I have the discipline and the understanding of why I want to do this. Maybe I'm willing to work harder. So I started taking those math classes and realizing that that I was wrong, that like, you know, sometimes we decide these things about ourselves and they're not necessarily true. And saying that I was not good at math wasn't true. I just wasn't trying. And so I decided to really focus and try, because to me, the ultimate goal to become a nurse felt really important. It would be work that gave me meaning. I could find a sense of secure employment so that if I could pursue the things that I wanted to be doing that maybe weren't going to be giving me the ability to live a stable, secure life financially. And also, like, I wanted to be doing, as I said, work that felt important and part of something important in people's lives. So that's kind of what the journey was. I then went back to school and started studying the arts and the sciences and the math and all that I needed. And it wasn't as bad as I thought it was going to be. I guess because I was motivated, where before I didn't feel motivated.
That's great. That's a really succinct narrative, I think. So I'm going to take a break here, check that we're recording. I'll have to end the meeting, so I will send you a new link.